Good morning. Good morning. This is Pastor Diane Dillahunt coming to you once again on this beautiful morning where we are preparing to prosper right here at Reach Gospel Radio. I want to thank you for joining me again this Saturday morning. And today I want to talk with you about the Medicare annual election period. It has actually started this week, October 15th. So it has officially begun. And I just wanted to remind everyone who has Medicare that this is your opportunity to make changes in your Medicare plan if you feel that you might need to do so. This is going to be a very important year for everyone to pay attention to what's going to be happening with healthcare this year because everything that we choose to do or you choose to do in this year is going to become effective for you on January 1st, 2026. And because there may be some changes in Medicaid, there's going to be definitely some changes in the Medicare plans that are available out there and the Medicare Advantage plans that you have available to you. It's going to be very important that you take the time to discuss it with a professional Medicare broker or representative who is licensed to enroll you into a plan. As I said, I still talk about the Medicare plans and Medicare enrollment plans, but I do not enroll anyone anymore. So please don't try to reach out to me to enroll you. However, I can kind of refer you to one of my friends who currently does enrollment for Medicare. So some of the things that you might want to take a look at for the Medicare programs this year would be whether or not you need extra help paying for some of the healthcare costs that Medicare does not pay for. And one of the first things that many people look into getting help to pay would be the Part B premiums that you might have to pay, or some of the prescription drug benefit payments that you might have to pay. There are programs that are available. One is called the QMB program, and that particular program covers Part A premiums for you. Now, many people will qualify for Part A and not have to pay for Part A premiums because they've worked 10 years or more in the United States. And so you automatically receive your Part A Medicare benefit when you turn 65 or when you retire. Not when you turn 65. I won't say retire because retirement age is now 67. Um, the other program that might be important to you would be the SLMB program, or the Specified Low Income Medicare Beneficiary Program. And that particular program covers your Part B premium, and everyone has to pay for Medicare Part B. Part B is the part that pays for your doctor visits and your specialist visits and some other benefits. And this year was about $182 to $185 a month for Part B. Well, the SLMB program, or the Specified Low Income Medicare Beneficiaries Program, is available to those Medicare beneficiaries who qualify based on your income. You can qualify to have that Part B premium paid for you through the SLMB program. Okay. And then you have individuals who have Medicaid and Medicare, and they are able to join a Medicare Advantage plan that has dual eligible benefits, or benefits for dual eligibles, people with Medicaid and Medicare. So that's going to be very important for you to take a look at as well. See if you qualify for Medicaid, and if you do, you can have Medicaid and Medicare and choose a plan for dual eligible enrollees. Someone else who could be dual eligible could be someone who is under 65 years of age, but they have some kind of disability that has qualified them to have Medicaid. as well as Medicare. And again, you do have an opportunity to choose a Medicare Advantage plan for yourself. Okay. The other thing that you want to be sure that you look into would be the hospitals that you want to see. Make sure that they are still available within your plan service area, but some may not be or may no longer work within the hospitals that you want to visit, as well as your specialists. It's going to be very important for you to check with any specialist that you may be seeing to be sure that they are part of the plan that you intend to choose for the new year. Okay, so that's something else you want to look into. Another thing would be prescriptions. Check your medications. Each health plan has a formulary, a listing of medications that they cover and what their co-payments might be. Take a look at the formulary of the plan that you want to choose before you make your choice. It's going to be very important that you're able to continue to get your medications. And if you are able to get a plan that has a Part D prescription drug benefit, then you will definitely benefit from some of the cost savings that you'll find for your Medicare prescription drugs. All right, so those are some of the things that you want to take a look at during this year's annual election period for Medicare. And be sure again to speak with one of the Medicare professionals that are out there available to help you to make your decisions. I know that you're going to be receiving a lot of phone calls. This is the time now where the Medicare marketing representatives are just out there. They want to reach out to you and help you to make those choices. So please be kind to them when they call. I know that you're going to be bombarded with calls, possibly because I do have people who already are telling me, Diane, they're calling me already. And just be kind to them. You know, if you've already made a decision, you can let them know. They'd be happy to say, okay, thank you for your time. And if you find that you speak with someone that you trust and that you want to invite to sit down with you to go over these plans, absolutely, it's a good idea to do just that. Okay, so open enrollment began October 15th. It goes through to December 7th, I believe it is. And everything that you do to make your choice will become effective for you January 1st of 2026. Okay, so happy enrollment time, happy AEP, make it a good educational time. Look at things like some of the benefits that you can get out there, the Silver Sneakers programs, you know, which is a nice exercise program at no cost to you. Many of the plans offer that, so take advantage of it. It's an opportunity for you to get out and move and keep yourself fit throughout the winter months. Right? So the next thing I want to talk with you about, and because this is Reach Gospel Radio, I want to talk to you a little bit about Bible study, just in case you missed it this week. And this week I joined a Bible study session with shout out to Overseer Gail Burke, who gave a wonderful lesson on the book of Esther. So she gives a Tuesday Bible study for women, and we are studying the women of the Bible. So this week we went into the book of Esther. And I think the important points that we made about the book of Esther is the fact that there was some preparation before Esther was able to go to the king, before the king. Okay, because remember now, Esther was an orphan, and she was Jewish. She was a Jewish orphan, and her uncle Mordecai worked in the house of the Persian king, King Xerxes. And so he hid her among the women there because she really didn't belong. But being an orphan and he was working, he wanted to be sure she's in a safe place throughout her days. He hid her in the king's harem, I guess, just among the other women. So she wasn't hidden. She was able to move around and so forth, but she didn't really belong there. She wasn't one of them. And I guess the point that was made here was that when the king decided that he was looking for a new queen, this was an opportunity that Esther had, and it was almost a calling from God for her to go before this king and see, what it is that God was going to do to use her in this space. Because as you know, there was a plan, a plot by one of the king's men, Haman, to kill and attack Jews. And so once Esther heard about this, knowing that her people were going to be attacked, she felt, okay, God is telling me this is my opportunity to do something to help my people. And just like all the other women, Esther was prepared to go before the king. They bathed her, she bathed in special milk baths and, lotions, and prepared their body physically. She prepared herself mentally because she had a plan. She knew she had a reason for going before the king, even though she was very nervous about going before the king. So she had to mentally prepare. So it was physical preparation, mental preparation, and then the approach. And when she was placed among all of the other women, and King Xerxes kind of saw her and spotted her, he was like, whoa, who's that? You all know that feeling. Who is that one over there? And, I haven't seen her before. And it turned out to be Esther. The king was attracted to Esther. So that was a wonderful thing. And he did allow Esther to come before him, but she didn't do that without 3 days of fasting. So, fasting is something else that you might want to do before going to do something important that God might have asked you to put on your heart for you to do. All right. So, preparing herself, knowing what you want as an outcome of a plan, because her outcome was to get the King Xerxes to stop the killing of her people. So once she was presented to the king, and he was like, Esther, you're the most beautiful among these women. And, he was choosing her. I'd like to choose you as queen. Anything you ask of me, I will give to you. And so she said, well, I hear that there is a plot to kill my people, or to kill my people. And, she just asked him if the people will have the right to defend themselves. She didn't say don't go after them. She said, I just want them to be able to defend themselves. And he gave a decree, sure, they can defend themselves. And that alone kind of led to the Haman not actually being able to just kill them like he thought he could. They now could defend themselves. And then when she told the king that there's someone that made a plot to kill her people, he's like, who is this? And when she told him it was Haman, the same gallows that Haman built for the Jews that he chose to kill was used on Haman and killed Haman. So sometimes when we're not in the place where we need to be, or where we think we should be, we're among people that are foreign to us, or in places that might be foreign to us. Think about the fact that God might have put you there for such a time as this, is what it was said about her, that she was placed in this space for such a time as this, to be used by God to save her people. So to go from being an orphan to saving your people in the king's house, and then to become the queen, a Jewish queen in a Persian household. So understand that God can use anyone. God can use each and every one of us to get what he wants done. All right. And it helps to have a godly purpose. When you go to God for something, or like when she went to the king, she had a godly purpose. It wasn't only about her. When your purpose is about someone else, if you're doing something that's going to benefit others other than yourself, just know that God is right there with you, to stand with you and to help you to fight that battle. And many times God will just fight the battle for you. You've already won. Amen. So I just want to thank you for joining me today. Just know that if you're doing something with a godly purpose, you've already won. All right. Have a wonderful day today. Enjoy the rest of your day. Thank you so much for joining me this morning as we are preparing to prosper. I'm here every Saturday mornings at 7:15 a.m. right here at Reach Gospel Radio. God bless you. Have a blessed day today, and I will be back soon.